Well, a landmark study about breast cancer could rewrite the rules for treating the disease. The U.S. National Cancer Institute says the majority of breast cancer patients can safely skip chemotherapy without hurting their chances of survival. So for more, I want to turn to Dr. Tim Whalen. Dr. Whalen is an oncology professor at McMaster University and co-investigator of this study. He joins us from Hamilton, Ontario. Thank you for being with us, Dr. Whalen.
Thank you, Arthur. Happy to be here.
First, let's start with why this study is so significant.
Well, this study is important for a number of reasons. We've been using for several years now biomarkers to identify a baseline risk for women and to determine whether or not they would benefit from chemotherapy. And the tests we were using, we knew that women with a low score had a low enough risk that they didn't require chemotherapy, and women with a high score had a high enough risk and would benefit from chemo. But we really didn't know about the intermediate risk group, which represents about 30% of women with this condition, node-negative breast cancer. And this study clearly shows that the women with the intermediate risk group also do not benefit from chemotherapy and have a relatively good outcome so that they could avoid the acute and long-term side effects of chemotherapy.
Now, in terms of the impact for cancer patients, for breast cancer patients, I know looking at the study, it says it could spare up to 70,000 patients a year in the United States and many more elsewhere, the ordeal and expense of these drugs. So how many women could it impact here in Canada?
Well, in Canada, about 25,000 women per year are diagnosed with breast cancer. And this study was related to about 50% of those women. And, it's likely that about 5,000 to 10,000 women could benefit from knowing this information and making decisions about chemotherapy.
Now, you talked about the different categories. There's high, intermediate, and low risk, certainly when it comes to patients' diagnosis and the stages of treatment that they would then require. So how do you actually determine which women can forego chemotherapy? What sort of tests need to take place?
Well, this is a test that we were testing, actually. It's a new biomarker which actually tests the actual genetic expression in the cancer cells. And we can tell now that some women who are going to be low risk because the cancer is not likely to return, and some women are going to be high risk because the cancer is likely to return. And now we have identified a group of women at intermediate risk who actually will not benefit from chemotherapy. So it's one of the first times we're starting to use the genetic expression of the cancer to determine the need for chemotherapy. It's very exciting, and it's going to change the way we look at other treatments too. We're about to start a large study using this test actually to determine whether or not women need radiation therapy. And that'll be a study across Canada and the United States run by the Canadian Clinical Trials Group called MA39.
Now, certainly, Dr. Whalen, when it comes to cancer patients, looking at the outcomes of different studies, it is something that, of course, can be a bit of a challenge when it comes to those patients feeling a little bit uncertain about the outcome and about the treatment that is available to them. So do you think there might be a little bit of difficulty in communicating that some of these patients don't actually need chemotherapy? I mean, looking at some of the publications out there, medical officials say that many women think if I don't get chemotherapy, I'm going to die, that they believe it's an insurance factor when it comes to fighting the disease. So how do you see dealing with that?
I think there'll be some difficulty because women understandably are quite anxious about cancer. But this study, Artie, is important because it was in over 10,000 women that were followed for up to 7 to 8 years. So we have a lot of confidence that where we know where chemotherapy is going to be necessary and where it's not, and where it's not going to be effective. So this actually should be very reassuring to women because previously we never had this information. So I think it's going to actually help reduce their anxiety because in addition, not only did it show that chemotherapy was not effective, but it showed groups of women that had very low risks of recurrence, which again is very reassuring.
And finally, Dr. Whalen, I wanted to ask you, this study is the largest ever done in breast cancer treatment, and it's been 12 years really in the making. So are doctors already introducing other options to patients instead of chemotherapy?
Yes, we are. So we're introducing new targeted therapies to cancer. The particular one we use commonly is We target the HER2 receptor, and we use trastuzumab, which is not a chemotherapy. And there's other drugs now available like pertuzumab. But we're also studying drugs for this group of women, this ER-positive group of women, that could be beneficial as well, which target the cancer specifically.
Well, thank you so much for your time today, Dr. Whalen. That was oncology professor Dr. Tim Whalen joining me from Hamilton, Ontario.